is going to be interesting. Hi, everyone. Good afternoon. My name is Yasser Shabir. I'm a fourth-year medical student from the University of Nairobi and a member of the MSAKE COVID-19 task force. I would like to welcome you to our webinar today, where we're going to sit down and understand what it is like to be a frontline healthcare worker in this whole COVID-19 pandemic. If you guys have any questions during this webinar, please do post them in the Q&A box and we will have them answered for you. Without wasting much more time, I'd like to invite Dr. Mbuvi. So Dr. Mbuvi is a very dedicated doctor who has been out there, saving lives and protecting us as we stay at home. And he's interacted with a lot of COVID-19 positive patients. And yeah, he is a frontline healthcare worker. Dr. Mbuvi, we appreciate you and we thank you very much for all the effort you're putting towards and contributing towards this pandemic. We'd like to welcome you. Thank you, Dr. Mbuvi.
Hi guys. Hi. Sorry for the bit of a delay. We've been a bit busy, as you can imagine. Things have been quite. Guys, just give me a second. Let me just do a few things here. Okay, cool. I hope you guys can hear me. Maybe you guys can wave or say something so that you can know you guys are hearing me.
We can hear you, Doc. We can hear you.
Okay. Okay. So, thanks. Okay, so thanks guys for this opportunity. Sorry, it was a bit hectic, but we somehow managed to be here today. I'm sorry about my computer keeps shaking. I'm actually in the office right now just trying to get this done. So yeah, experiences as frontline healthcare workers, yes. Okay, so for introduction, my name is Dr. Mutua Mbuvi. I work at the Kenyatta National Hospital. I worked in the accident emergency department, but then when COVID now became an issue, I was moved to the infectious disease unit, where we work at the Mbagathi facility and also at the KNH KNH infectious disease unit. The two areas, those are where we actually work. maybe what I can do, I can share a small presentation that we've been doing. Maybe just to give you an overview of what we've actually been dealing with at KNH. Just a few things. Sorry, just give me a sec. Yeah. Okay. So that's basically the KNH IDU unit. This is at the Mbagathi facility. I didn't add, this presentation doesn't have a lot of pictures. It's just basically, this is the place where we actually have most of our confirmed cases at the Mbagathi facility. It's at Mbagathi Hospital, but it's run by Kenyatta National Hospital, and that's where we actually treat our patients. Currently, we have about 35 confirmed cases who we are currently managing at the facility, and it's divided into two wings. There's what we call the confirmed side, and there's what we call the suspect side. So if you come in and you have not yet been screened for COVID, we usually admit you to the suspect side until we get the results of the PCR results. And then if they turn positive, then we move you to the side of the confirmed cases and where we begin our management. So we have had quite a number of patients who have come through. And like I've said, we currently run 3 facilities or 3 centers for COVID as KNH team. So we have the IDU or the critical care unit. This is a designated space for basically infectious disease for IDU, but more for critical care. This is where for patients who develop like really severe symptoms of COVID-19 and they require to be intubated, they require that critical care aspect, that is where they are admitted. It's currently a 6-bed, actually it's an 8-bed facility, but has the capability of being increased to around 10 to 12 beds if need be. So it's currently up and running. And then we have the KNH IDU Mbagathi facility, which is where we have majority of our confirmed cases. And these are mostly people with mild to moderate conditions of COVID-19. So we manage them at that place. The KNH Daycare Center is basically a place where it's exclusively kept aside for healthcare workers. So if you're a healthcare worker and you end up becoming confirmed positive, this is where we actually take you. And this is what we actually do. We take care of you. It doesn't matter what kind of a healthcare worker you are, whether you're a doctor, nurse, lab tech, farm tech, any of those things from any part of the country, and you need to have care. This is where we'll bring you to the daycare facility where we actually take care of our healthcare workers. The staff in our place now, we actually we have a lot of our specialists who are with us. We have infectious disease specialists who are currently, actually there are 4 of them. We actually got new ones just this week. And we have our critical care unit specialists, our respiratory and infectious disease specialists, medical officers. We are this one's of 15, but we've gotten more. We're now about 20 of us. Nurses are around, currently they're around 55. The pharmacists are 2, pharm techs have also increased to around 4. We have almost 10 counselors who are available for both the patients and the healthcare workers. We have the lab technologists who are responsible basically for taking the samples and actually dispatching them to the various laboratories. Physiotherapy guys and radiographers for those patients who may require physiotherapy or may require x-rays to be done and things like that. So since we started out on 13th March when the first case was actually announced, so far we have seen about 955 patients who have been triaged to our facility. About 40 of them had been discharged without being tested for COVID, and this was because at that particular time, we were using the case definition of the Ministry of Health, which basically was keyed towards the people who actually have traveled outside of the country or have traveled to areas where COVID-19 had actually been a confirmed case. But now where we have community transmission, we're now testing anyone who comes into the facility if they present with symptoms, because now we know that this thing is in the community, so we cannot be using the travel history as one of our guides to who do we test and who do we not test. Of those confirmed negatives have been 832. We've had a total of 82 confirmed cases. Mortalities, we've had more mortalities than this one. We've actually had like 3 more. And we have foreigners who have been in our facility, around 13 of them. Comorbidities of these patients, including HIV, diabetes, and hypertension, have been also noted from these patients. So now, our biggest age group of the people we get in our facility are between the ages of 20 and 49. The good thing about that is that majority of these patients are actually very, very stable. They are asymptomatic at times. Others do not present with any major symptoms. They have mild symptoms. So mostly what we do is just isolate them and do their basic blood works, check their vitals every day and things like that. Then in case anything else pops up that requires medication, then we treat them at that particular point in time. Mostly we have more male than female of our patients. More of them are male than female, which ties together with what is currently being seen in the rest of the world. Like I said, majority are between the ages of 20 and 49, which, as you can see, the majority of them are male patients. And sometimes you have a few female patients, especially in the group of 40 to 49. We have more female patients than male patients at that point. So working in the IDU facility has had some highlights because we work as a team. At this point, it doesn't really matter whether you're a doctor, you're a nurse, you're a lab tech. Once you don the full gear and you go inside into this facility, you may end up finding that you're helping the nursing team to make the patient's beds, or the nursing team is helping you to even draw blood from patients. Because at this point, when you go inside what you call the hot zone or the red zone, where you have the confirmed cases, you cannot start having that hierarchical thinking. Over there, we're a team. And as a team, we have to work together so to ensure that these patients get the best care that they can get at any time. We have patients who have been with us for a long period of time, so seeing them going home after finally testing negative has been one of the key things that we have been, part of the things that we've been actually been very happy about. And this was a bit up to last week. We did not get any critically ill patients requiring intubation and mechanical ventilation. However, that has actually changed because we have had a few patients who have come in who have actually needed to be intubated and put on mechanical ventilation. So that has been something that has been a new development, given now we're getting more cases coming in, getting people who are much, much sicker coming in. And that's one of the things that we have been seeing. And one of the best things we've learned as well is the aspect of mental health, not just for the isolated patients, but even for us as healthcare workers. Because if you look at how we do our shifts, most of the times, yes, we do get to go home at the end of the shift, but you're supposed to be on quarantine. Like for me, I stay at home, I stay alone. So I can come home and actually just chill by myself and do that. Because now you have to make sure that you do not, in as much as you're working in a COVID, you're working with patients who are COVID-19 positive, you cannot now be the person who's transmitting it to the rest of the community. So KNH has actually provided houses for us to stay in for those who actually feel like they cannot go back home to their families. They have a place where they can go and stay and do self-quarantine. And we are tested for COVID after every 2 weeks, because we're always on the front line. So after every 2 weeks, you have to undergo a test to make sure that you're still COVID negative, so that you can continue dispatching your duties as need be. So we have counselors who help in terms of mental health for the patients and also for the staff who require. And you get to see them anytime that you want, if you feel like you need to talk to them and things like that. So this was just a small overview of what we are currently going through at the facility. So if you'll allow me to stop the share, then I can just continue with just a simple discussion. So the experience as a frontline healthcare worker, first of all, what we have seen, or what I've personally seen, is we have a lot of stigma. There's a lot of stigma, especially to patients who are COVID positive. And even when they turn COVID negative and we release them and we discharge them to go back home for quarantine, or they go back to their families, there's still that stigma that is still being propagated and still continuing. The thing is that this stigma is also being seen in healthcare workers as well, which is something that can be quite frustrating at times, because people tend to now develop what you call a hands-off approach. If a patient is a suspected COVID patient or is a confirmed case, other people do not want to deal with this patient. So the burden now falls on us as the team that is in the infectious disease unit to now take up this particular role and to be able to continue with the care and the management of these patients, and just to ensure that when they go back to the society, that stigma has either reduced or something like that, but it's not yet happening. The stigma is there, the stigma is real, the stigma is, to a point I can actually say that stigma is actually worse than the stigma that people have in terms of other conditions like HIV and AIDS and things like that. Because of the fact that you can get this disease through just simple talking to someone, and the droplets come out of them and they get to you and you get infected. That has really, really scared a lot of healthcare workers. It has scared so many people who are dealing with patients. And if you look at the trends currently, whether it's public hospitals or private hospitals, we have a significant decrease in the number of patients who are actually presenting to facilities to be treated. And because they actually have this feeling that I may go there and I may actually meet someone who's COVID positive and I may end up getting that same condition. So that has been the experience that we've had. We've had patients who unfortunately have died because of such negligence, because of such hands-off approach, because someone just said that this person might be having COVID. And once that has been said, what they usually do, especially in other hospitals, when they say that a patient is possibly COVID positive or they suspect that this person has COVID, they will just refer them to us in Kenyatta at Mbagathi. And sometimes, unfortunately, this patient come in very, very late and we end up losing these patients. But upon testing them, we actually come to discover that these patients were not even, they were actually COVID negative, but they just presented with symptoms which might have suggested that they could be having COVID. So there's still that stigma, there's still a very big need for us to keep educating not only the healthcare workers, but also our own people in our families, making them understand how COVID-19 is spread, how to stop this prevention, the importance of wearing a face mask at any given time. And as you leave your home, or if you're going to a public space, how to social distance, how to always ensure that you have you always have a mask that you're wearing. Because the studies that have been done have actually shown that if I wear a mask and you wear a mask, the transmission is significantly cut down to around 1 to 5%. But if let's take an example, if I am COVID-19 positive and I'm not wearing a mask and I'm just out there walking, sneezing and talking and coughing and all that, and you're wearing a mask, it means that you actually have an almost 50 to 75% chance of actually getting COVID infection. But if I'm wearing a mask and you're wearing a mask, this risk is significantly cut down to around 1 to 5%. So this education is something that we need to keep going, and especially for healthcare workers. And also for you guys as medical students, you're part of the fraternity of healthcare workers, because this is where you're going to next. So understanding how COVID-19 works and understanding how it's spread and how to stop this spread and how to take care of the vulnerable in the society should be one of the things that, as MSAKE and our medical students, you should be at the forefront of passing this information to your classmates, to other medical students everywhere, so that they can understand how COVID-19 works. And then at that point, you can begin to stop the stigma that is currently ongoing, that is really, really affecting healthcare, that is affecting how we treat other patients who are not COVID, who do not have anything COVID related. So that's one of the things that I really wish we could be able to do. So I think for now, what I can do is that I can answer questions if you guys have, then maybe you guys can trigger something that I've not said and I can remember, and I can be able now to just give like a more detailed explanation if you guys want to. So yes, sir, I think I'll just leave it to you so that you can now moderate the questions if anyone has. I'm here, I can answer a few questions, though I may not take a long time because I do have another meeting that I need to go for, but I'm here to answer your questions. Thank you.
Thank you, Dr. Mbovi. Now I'll just hand the floor to Tim. He will moderate the.
Okay, first of all, thank you so much, Doc, for your presentation and for the work that you guys are doing at the forefront. We're really grateful for everything that you are doing. I know many people might not be noticing it, but we're really grateful. So we have a few questions. Maybe I'll just get right to them. So maybe the first question, in your opinion, are you people in the front line? Are you doctors in the front line, the nurses, the farm techs? Are you getting enough support from the government in terms of personal protective equipment or any other support that you believe would be vital at this time?
Okay, thanks for that question. What I can say, I'll give my experience from KNH perspective, because that's where I work. That KNH is my employer. So far, since the COVID-19 response started, from actually even way before the first case was announced, on March 13th, we had already been activated as a unit in KNH. So we were already dealing with suspected cases. So there are patients who will come, they were suspected cases, we would treat them, do the COVID screening. Once we find that it's negative, we discharge them. But the first case that came in on March, the patient was confirmed on March 13th. That's when the whole, let's say like now things started now flowing properly. Now things, it suddenly hit us that, you know what, COVID-19 is here. And now we need to step up our game. We need to activate the things that we need to activate. We need to ensure that we have the personnel ready to treat these patients and just have the spaces that we require for us to treat the patients. So with that, KNH has actually been a very, very supportive employer. From the time we started this thing up till today, if I can say, we have not lacked PPEs. We have had enough PPEs that we need for all our staff who are actually working in the frontline, both the nurses, lab techs, everyone, we have had the PPEs. But we also understand the fact that with time, as you continue getting more and more cases, we'll end up having a situation that is currently being seen in the US, in Italy, and in Spain, and also in China, where the PPE started running, the supply of PPE started reducing. But we are hoping that with the current government measures where they have decided to ensure that we have a lockdown of the country, not really a lockdown, but more of a curfew over from 7 till 5 a.m. This has helped to reduce the number of people who are actually getting into contact with one another, and has actually helped to slightly flatten the curve that we have been experiencing with COVID-19. And this is something that has actually helped us to get to a point where we can be able to do things much better. And with that flattening of the curve, it has given us a sort of like a buffer zone that allows us now to prepare much more adequately, so that when now these cases begin to flood our healthcare system, we actually have a way to deal with them. But we're also looking at aspects of where, how do we take care of the really, really vulnerable people in the society? But when you talk about in terms of getting support and getting the equipment that we need, and getting the PPEs, and getting just the available human resource that we need to manage COVID-19 at KNH, the hospital has actually done a fantastic job. But so far, we have not lacked anything that we need at the moment. Yeah, thanks.
Okay, thank you so much. And I know that can be a bit difficult getting the PPEs, but it's really good to know that you have enough. So we have one of the attendees, and it's anonymous, and they ask, what are your thoughts on the patterns of numbers tested positive? Because sometimes we see 20, then it increases, then it goes down. So is this in line with the situation you're seeing on the ground with the patients?
Yeah. Okay. Yes. So that is it's in line with that. Now, the reason why those different the patterns keep changing, it's just basically on the terms of testing. So the government recently rolled out the testing for mass testing. Let me call it that, mass testing. But like I said, there's still a lot of stigma that is out there about COVID-19. So we're not getting the number of people who are presenting to the mass testing areas that we anticipated. And number two has been the issue about, if I'm confirmed positive and I'm put in a facility, who's going to cover the cost? So most times you've seen that people have been complaining and saying that they've been told to pay, and they've been told to cater for their own. If they are stayed there for a period of time, there's a certain amount of money that they're supposed to pay. So this has also been one of the things that has kind of blocked the flux of patients that we were expecting to see, because people are a bit afraid of actually coming out and being tested, because they know if they're found to be positive, then it changes the entire story. Because now, if let's say my work is I'm a person who depends on day-to-day living. That, let's say I work at a construction site, so I'm dependent on that day's work. So if I work today, I'll get money. I work tomorrow, I'll get money. I'm not a salaried person who will get his money at the end of the month. So if you have such people and you put them in a quarantine facility, first of all, you have the economic empowerment has actually been affected. And then at the end of their quarantine, or at the end of the isolation, you tell them that, okay, now you need to pay. You see that it becomes an issue. This person has not been at work. He does not have the money. He cannot be able to cater for this, to cater for that actual payments for whatever treatment that he has received. So this has been the reason why I personally believe that we have been having these fluxes in the number of patients who have been coming in, or in the number of cases that we've actually been able to diagnose. Because some will come, tomorrow others will be like, no, I'm not going because I've had so-and-so, maybe my neighbor has been quarantined because he went there and things like that. So that could be one of the reasons as to why we're having these variabilities. Yeah.
Okay. Thank you. Thank you for that insight. Maybe another one. Cheryl is asking, do you think it's feasible to continue with life? And what do you think about students going back to school, especially maybe thinking about medical students? So do you think it will be negative, it would have a negative impact, or what do you think?
Okay. My personal opinion would be this. COVID-19 is probably here to stay for a while. Now it depends on how we begin to view this infection. From what we have been seeing, our current trends is that, like I said, most of our patients that we've seen at KNH are actually young people from the ages of 20 to 49. And these people are mostly asymptomatic. So now that begs the question. We have different countries that have done different things in their response. You notice that in Spain and in Italy, they actually did a full lockdown of the country. Even in China, they did a full lockdown of the country. So they could try and stem these infections and how people are getting infected. And people have actually recommended that Kenya should do the same, but we cannot just look at this statistic from one perspective only. We also need to look at now population dynamics. If you look at Europe, majority of their population is actually elderly people, not really elderly, but like their mean ages is around 40 to 45. But if you look at Africa, on the other hand, Africa has a mean age of around 19, 20 years. That's a very, very young, it's a very, very young continent. And given that young people tend to be a bit, what I can say, maybe they tend to handle COVID-19 a bit better because they are asymptomatic and they turn negative after the 14 days and you get to discharge them without having to put them through critical care and things like that. Those are some of the things that we need to look at. So we cannot look at it just from one perspective. Now, the aspect of guys going back to school, it could go both ways. One, bringing people back to school, like I could say, populations, the one thing that we need to do is now social distancing and wearing masks. And it seems like for a foreseeable part of the future of this country, wearing a mask will not become like part of our routine, especially if now we're dealing with COVID, and chances are that this disease is here to stay for a while. So wearing a mask is going to be one of the things. I believe at some point, we may actually have to open up the country again. We may have to allow people to go back to school, because at some point we may not be able to sustain people not being at work, people not being in school for like almost a year and a year plus. That is something that maybe might not be able to work. So at some point we may be forced to actually open up the country and open up people not to go back to school and that. But the key thing about that will be what measures will be put in place once this is done. Because we need to ensure that there's still social distancing. We still need to ensure that people are still wearing their masks so that we can limit the spread as much as possible as we continue moving forward and trying to contain this disease. And I have a feeling that this is something that can be achieved. Just the getting back to a near normal situation that we were in before COVID-19 presented itself. This is something that can work, but we just need to have the proper measures in place to ensure that if we do allow people back to school, if we do allow our medical students back to school, what are the contingencies that we are putting in place? What are the universities and the hospitals going to put in place to ensure that we do not get a certain spike in the number of cases of COVID-19? Consider that it's already in the community. So either making sure that the universities have hand washing areas, designated hand washing areas, that students are given masks, that even when you're going for your lectures, that this social distancing is there. So this is something that is it will require a lot of planning, because if you assume like if you have a class of 300 people and they're both in one lecture hall, how will you maintain social distance? How will you maintain the 1 meter from one student to the next? It means you will require a much larger facility to hold these people. So that also now comes into the fact of cost. And do we need to build bigger lecture halls, or do we need now to move outside the lecture hall and have maybe like tents where people can sit and actually have the lectures? Or do we now get to a point where we allow people back in school, but we now make use of technology like Zoom, like Google Classroom and such things, so that people can still continue with their classes and have minimal like personal interaction, like where you have people seated in the same room at the same time. Yeah, but then now, like for medical students, then now it comes now to the point of like when you're going for a ward round, what happens? how many of you are going to be there for the ward round? Or do we limit the number of people who are going to be there per day in a ward round? So these are all the things that people need to think about them before we say that we're going to allow, we're going to open up schools again, or to open up the society again to people to continue interacting on a normal basis. Yeah.
Okay. Yeah, thank you very much. Maybe you can allow me, Doc, just one final question. So we have Christine Mutonyi, and she asks, how do you feel your training and experience over the past years has prepared you for this, handling such cases?
What I can say is this. There's no training that has helped at all. So the only thing that we have done is basically learning about how to do infection prevention control. When you learn about how to put on the suit, how to don and to doff, that is a basic thing. It's mostly about infection prevention management. Now, what we learned in medical school was nothing close to this. And the most interesting thing about COVID-19 is that it's a new virus. The fact is there are no experts on COVID-19. Every single person who's meeting COVID-19 always has something new to say about it. The Chinese have their research, the Italians have their research, the US has its research. Very many new things keep coming up every single time. So in as much as what you learn in medical school may not fully prepare you for this, but this is something that I believe comes from experience. The more you keep seeing these patients with COVID-19, the more you understand the aspects of how this disease progresses and how it moves from one person to the other. How does it cause the severity that it's causing to the patients who actually get severe infections, they get to actually pass on. It's something that comes with the experience, and with also how many cases of this are you seeing in a day? How do these patients present? And also being able to pull back and sit and look at the data and the literature that is there, and seeing how this thing has affected other countries and how the healthcare workers in that particular country went forward with the experience, and how they used their experience with this to create protocols and management protocols for that. So basically, like right now we have medical officers who joined us fresh from internship. So we're currently taking them through that training of how to work with infection prevention, how to put on the suit, how to do the donning and the doffing, how to understand how the layout of an infectious disease unit is like, and such things. So this is something that it's on the job learning. I don't think it's something that you'll actually learn in class. It's not something that you'll actually learn in a lecture. You can have the theory in class, yes. And as you know, theory is okay. Theory will give you one thing, but experience and actually being in the field gives you a totally different aspect, a totally different way to look at things. And it also gives a point to one of the things that we always say, that diseases do not read textbooks. A disease, they will say pneumonia will start from here and it will go like this and it will go like this. But in the field, in as much as you'll diagnose that pneumonia, but it will come in the most strangest of ways that you've ever seen. So it's all about the experience. It's all about understanding, keeping the knowledge that you have, ensuring that you're trying to keep up with the data. The thing is, right now, there's so much data that has come out for COVID-19. Very many countries are publishing, very many journals actually are putting out information about this. So it's just up to you to actually figure out which journals do I need to read. What do I take from these journals? What do I take from these researchers that can actually help me and help my patients at the end of the day? Yeah.
Okay. Thank you very much, Doc, for your responses. And once again, thank you very much for the good work you're doing. We commend you. So at this point, I'd just like to hand the floor to Yas to finalize.
Thank you. Thank you very much, Tim, and thank you very much, Dr. Mbuvi. First of all, as medical students, as MSAKE and medical students from around the world, we would like to thank you very much for all the effort you're putting in fighting this disease. Indeed, you are our hero in this country. We are no longer following Superman and Batman. You guys are the heroes at the moment. And I know you're very busy in this situation. I mean, you work in an accident and emergency department, so we really appreciate your time that you have removed. I mean, this time has been very informative, and it's very valuable because you're educating us, and we are future healthcare workers, we are future doctors. And please, on behalf of MSAKE and the medical students around the world, please extend our thank you to all to all the healthcare workers that are in the front line, and please tell them how we appreciate them, and we are very grateful to have you guys you guys do such a good job. And yeah, so claps and standing applauses for all the healthcare workers out there. Thank you very much, Daktari. And also again, this is now to the medical students. This thing is going to change a lot. Just yesterday, the WHO mentioned that the virus may never go and it may stay with us forever, but we still need to carry on with our lives. These things will also change our medical education. Medical school will not remain the same anymore. Ward rounds will not remain the same anymore. Training will not be the same. Our schools will now need to figure out a way to teach us and prepare us more for emerging diseases. And because remember, we're always at the front line for these emerging diseases. Yeah, so it's going to change everything. But what can you do out there as medical students? Trust me, you can do a lot in ending this pandemic. And one of the things you can do is public health education. Health education has been really is one of the preventive methods for any communicable diseases. Go out there, educate your families, educate your communities, educate your friends, educate anyone who educates them on what the disease is about. There's so many rumors around. Remember, we are students. We're not supposed to base our assumptions on religion or on other misconceptions around this whole virus. We are students, and we're medical students, and we're supposed to practice evidence-based medicine. So there's a lot of good information out there from the WHO. Please go look at it. Read something about COVID-19 every day, because this is the best time to learn about an emerging disease. It doesn't come every year, God forbid. But yeah, this is the best time. Learn about it and educate your families, your friends, your communities, and students out there. Thank you very much for attending this webinar. I'm so sorry it was very short, but as I said before, Dr. Mbuvi is a very busy man in the country at the moment. He's very special and a busy man in the country, and he also has to attend to his patients, and he has to, he plays a really important role in ending this pandemic. And I know for some of us, we have asked some really good questions. We will download the questions at the end of the webinar, and we're going to post the answer, and Dr. Mbuvi will answer the questions, and he'll post them on the MSAKE Twitter handles, on the Facebook page, and Instagram and WhatsApp groups, and all the social media. We will have answers to those questions, and a recording of this webinar will be uploaded on the MSAKE YouTube page. So thank you guys very much for attending this short but very informative session. And don't forget, guys, your role as medical students. Thank you and good afternoon. Stay home and stay safe. Bye-bye.